We described the PK/PD properties of antibiotics used for pneumonia and distinguished between various types of pneumonia, and used risk stratification tools to assess a patient's risk with pneumonia and aid in determining setting for treatment, and listed likely causative pathogens for each type of pneumonia. We also designed appropriate empiric therapy for a patient with community-acquired pneumonia. Now let's recommend an appropriate duration of therapy for community-acquired pneumonia. Now, when it comes to duration of therapy for community-acquired pneumonia, it should be guided by a validated measure of clinical stability. And in general, criteria for clinical stability, which are actually from the 2007 IDSA guideline, is that you use things like vitals, so temperature, heart rate, respiratory rate, systolic blood pressure, oxygenation of the blood, as well as ability to maintain oral intake and normal mental status. So these are the criteria you can use to basically see if the patient is clinically stable. And then, depending on what's causing the pneumonia, so in general, pneumonia for the most part will be caused by common bacterial pathogens like Streptococcus pneumoniae. So you continue antibiotics until the patient achieves stability, but no less than 5 days. So if, let's say, after 3 days of antibiotics, the patient is clinically stable, you basically finish 5 days. But if you have finished 5 days and the patient has not achieved clinical stability, then you basically continue beyond 5 days until you achieve stability in the patient. Now, for MRSA and Pseudomonas specifically, the guidelines recommend a total of 7 days. So even if the patient has improved by day 5, it's important to finish 7 days of therapy. And then, if you have community-acquired pneumonia due to less common pathogens like Burkholderia, Mycobacterium, and fungi, then longer duration of therapy may be needed depending on what the organism is. So there are various guidelines out there for these less common pathogens, which are beyond the scope of this class. And then, if the community-acquired pneumonia is complicated by other infections, then you basically may need longer duration depending on what the infection is. So for example, if someone has meningitis may require longer duration of therapy. So even if you're done with the treatment for community-acquired pneumonia, you need to treat longer in order to finish treating meningitis. The same is true with endocarditis and deep-seated infections. In general, deep-seated infections require longer duration of therapy in order to eradicate those organisms. Now, as patients achieve clinical stability, it's important to switch from parenteral to oral antibiotics. And when we do that, you can either use the same agent. So for example, if you have something like azithromycin or fluoroquinolones, it's easy to have the same agent that was IV. Just use the oral bioequivalence of it. However, some agents are only available as IV. For example, ceftriaxone is only IV. In that case, you can find an oral equivalent of that agent as long as it's in the same class. So in general, a third generation cephalosporin, you can switch from an IV to an oral. The same is true with the penicillins and beta-lactams in general. Now, sometimes you may see that the patients may fail to achieve clinical stability within 5 days, and this in fact is associated with higher mortality rate. Now, this failure can be due to different things, so it's important to assess the cause of clinical failure. Sometimes this could be due to emergence of resistance while on treatment, and other times it could be complications or another infection that might be going on simultaneously. One tool that we can use is serial procalcitonin in order to see when it's safe to discontinue antibiotics if the patient needs a longer duration. So once it goes beyond 5 to 7 days, we can actually get serial procalcitonin, and if the levels become low, then that's an indication that treatment has been long enough and it would be safe to discontinue. This concludes this presentation.